The Sozosei Foundation held its second annual summit to decriminalize mental illness from December 13th through 15th, 2021. The summit is a global event that brings together a diverse group of people to collaborate, create, and explore pathways to decriminalize mental illness. This year's summit focused on 988, the new National Mental Health Crisis Telephone Line, due to go live in July 2022, and followed a narrative arc of past, present, and future responses to mental illness. More than 500 people, both virtually and in person, joined us for the 3-day event. The name Sozosei means creativity in Japanese. We strive to be a catalyst for creative ideas and solutions. To do so, we purposefully seek environments and tools to unleash creativity and curiosity. Building on this, the summit was held in Philadelphia at the Pennsylvania Academy of the Fine Arts, the nation's oldest art school, and featured opportunities to make art, watch graphic notes being taken in real time, which are featured in this video, and gather at the Barnes Foundation, one of the most spectacular art collections in the United States. With creativity as a core value, we believe that together we can identify new pathways in order to eliminate the inappropriate use of jails and prisons for the diagnosis and treatment of mental illness. This video is a recap of the 3-day summit, and it's our hope that it helps keep aflame the sparks of insight and innovation the summit ignited, and inspires a future where mental illness is not a crime. Day 1 began with warm welcomes from Sozosei Foundation Board Chair Dr. Bill Carson, Board Member Kabir Nath, and Melissa Beck, Executive Director of the Foundation. To open the summit, Ms. Beck welcomed Ton Hall, Executive Director of the Miles Hall Foundation. Ms. Hall shared the moving story of her son's murder at the hands of police. His life was cut short at the young age of 23 during a mental health emergency near their home in California. Her recounting grounded the summit in lived experience and motivated participants to center their efforts on people, like Miles, who will benefit most from decriminalizing mental illness. 2 panel discussions followed. The first, Knowledge is Power, using the history of 911, legacies of racism and discrimination and lived experience to design for a better tomorrow, was moderated by Dan Gillison, with panelists Dr. Rebecca Newstetter, Dr. Eric Rafla-Yon, and Victor Armstrong. This panel inspired us to think, how can we dismantle legacies of racism and discrimination to ensure equity in emergency response? The second panel of the day, a reimagined system of crisis response, designing with community in mind, moderated by Moki Macias, in discussion with Dr. Margie Balfour, Dr. Talid El-Sabawi, Karis Myrick, and Tansy McNulty, lifted up new ideas of how to respond, as well as who should respond to mental health emergencies. It left us thinking creatively about ways we can transition into a culture that views those with mental illness as deserving of treatment rather than deserving of incarceration. How can we build and adequately fund an emergency mental health care response system that is centered on compassion and well-being for the person in need? The day closed with a call from Sarah Stein Greenberg, director of the D School at Stanford University and author of Creative Acts for Curious People. She encouraged us to fall in love with ambiguity as we pursue human-centered design in order to decriminalize mental illness. The day was capped off with dinner at the Barnes Foundation, where summit guests made important connections with one another as they viewed the museum's incredible collection. To begin day 2, Sozosei Foundation board member Mary Michael welcomed the first panel, Taking the Big Picture, a national overview on 988 and the crisis care continuum, moderated by Dr. Benjamin Miller, in discussion with Angela Kimball, Laura Evans, Dr. Charles Browning, and Tiffany Russell. This panel provided a national overview of the current status of 988 implementation. The key takeaway was that 988, as a full-scale mental health hotline, remains aspirational. a lack of funding, a lack of national standards, and a developing but not fully adopted use of technology all hamper its full promise. This panel articulated the need for more research and integration of information silos, standardization of data and collection methods, and the importance of telecom fees and Medicaid coverage for mental health emergencies. In addition, the panel spoke to the importance of listening to the voices of those with lived experience and those in BIPOC communities. Despite what appears to be a steep mountain to climb, optimism for the future was palpable, with the hope that 988 can one day fulfill its potential as an equitable, full-scale emergency mental health response system that serves the entire nation, along with a fully accessible system of mental health care. In a fireside chat moderated by Yolanda Lewis, we learned from Lori Chris and Rick Keller that agencies in Ohio have been working to build diverse collaborations to help increase access to mental health care across the state. Despite myriad efforts, access to good data, addressing the specific needs of rural versus urban communities, and rolling out 988 effectively are still challenges that must be addressed. Leadership in Ohio sees itself as playing a long game, planting seeds today for future success. The vision for the state's 988 task force is more care where people need it most. The goal is to create an infrastructure that will allow 988 to respond to calls, texts, and chats with a web-based service that could dispatch a mobile team and/or connect those in need to a crisis stabilization center that is ideally available in all communities. Attaining this goal will take time. For now, it is a seed being planted. More ideas came from South Carolina in a panel moderated by Melissa Beck in discussion with Major Maria Ituria, Allison Farrell, and Dr. Kenneth Rogers. We learned that the 988 task force is hard at work in South Carolina, but the state is far from ready. Among lawmakers, there is little knowledge of 988, and it remains unclear how the promise of 988 will be funded. Some perceive the necessary telecom fees as a tax, and while a request for statewide funding has been made, it has yet to be addressed. As that work continues, South Carolina benefits from tireless advocates like the National Alliance on Mental Illness and Richland County that have established a crisis intervention team. This team has embedded clinicians in 911 dispatch centers to address the more than 2,000 non-criminal calls the sheriff's office receives annually. Panelists also noted that behavioral healthcare has a partnership with the University of South Carolina to analyze data and help determine if this model works. So far, it's revealing that the crisis intervention team is working better in urban areas than in smaller towns and rural areas, but the state is still compiling data and still learning. Larry Krasner, District Attorney of Philadelphia, opened the afternoon session, reminding us of the important and often unrecognized role that prosecutors play in the criminalization of mental illness. He noted that the criminal legal system acts as a proxy for inadequate community-based care, and that if access to care is provided within communities, we will see a reduction in recidivism. He encouraged summit participants to follow the trajectory of so-called progressive prosecutors. Our next panel discussion, 988 Coming to a City Near You, Lessons from Philadelphia and Boston, was moderated by Dr. Bill Carson in conversation with Dr. David Henderson, Joan Taglieri, Dr. Jean Wright, and Dr. Sosamula Shoyinka. Panelists described how their city was using data to drive responses to mental health emergencies to avoid responses resulting in arrests. They underscored that evidence-based best practices should drive innovation and problem solving. Boston is just now analyzing its data and is eager to look across systems and programs to understand recurring patterns. As in South Carolina, an academic partnership has been established to facilitate data analysis that can help drive innovation and new ideas. For example, in September 2020, Philadelphia embedded a behavioral health navigator within 911 to ensure that if a call is considered behavioral, then the mobile crisis response team responds instead of police. Data collected from this partnership will help Philadelphia determine if this model is working. In conclusion, panelists determined that the key issue was post-emergency transition and extreme staffing shortages. In Philadelphia, some programs are helping to ameliorate some of these challenges, but addressing core barriers like staffing remains a steep climb. The afternoon of Day 2 brought innovation from across the U.S. into the summit through Pecha Kucha presentations. A Pecha Kucha is a lively way to convey ideas as presenters use images without written words to share 20 slides, with 20 seconds of commentary per slide, for a presentation of 6 minutes and 40 seconds in total. 8 organizations presented their unique ideas. We heard many concepts, including ideas on how to increase access to emergency services for the hearing impaired, how research in one city might help inform stronger mental health interventions nationally, and how breaking down data silos can free up funding for abundant mental health services. In-person and virtual summit participants then voted on the organization whose approach they felt would make the most significant impact. Out of the 8 presenting organizations, the Confess Project was voted the most likely project to successfully move the needle to decriminalize mental illness. The Confess Project is America's first mental health barbershop movement, which encourages cultural dialogue about Black male mental health in order to destigmatize mental illness and increase access to care. All organizations that presented Pecha Kuchas received a grant of $5,000, and the Confess Project received $25,000 to support their inspiring efforts towards decriminalizing and destigmatizing mental illness. The final day of the summit began in conversation and reflection with Dr. Tom Insel and Dr. Andy Keller, moderated by Melissa Beck. The 3 reflected upon the summit and its through lines. History can provide a powerful lesson in building our tomorrow. We need strong leadership to design the future, and that we must all listen to and amplify voices of those with lived experience and members of the BIPOC community. Additionally, designing a future where mental illness is not a crime hinges upon technological advancements, standardized data, data collection, and data analysis. This conversation paved the way for the Guild of Future Architects, a collaborative of writers and artists shaping a kind, just, inclusive, and prosperous world, who led us through their futurist writer's room. The audience participated in laughter exercises to break the ice and inspire our most authentic and creative thinking. We were then visually guided through a narrative future designed by the needs of community and asked to travel back in our minds to a significant place in history to imagine a different outcome from that moment in time forward. How would that alternative outcome help us design a future where mental illness is not a crime? The room was uplifted by the sounds of excited voices collaborating and exploring a more equitable future. Before concluding the summit, Sozosei Foundation Executive Director Melissa Beck encouraged participants to call upon the power of community as we work together to design and innovate for the future. Dr. Bill Carson reflected that the foundation had achieved its goal of being a clearinghouse of lived experience and information, a convener of advocates from a wide spectrum of expertise, while remaining constantly curious and supportive. However, implementation of 988 remains both a promise and a peril. There remains a need for more data, better research, and agreed-upon standards in the field of mental health generally, and mental health crisis response specifically. The summit concluded with Nicole Medina of Mural Arts Philadelphia, revealing the Sozosei Summit mural co-created by in-person and virtual participants throughout the event. If you did not have the opportunity to join us at the summit, you can view the full recordings on our YouTube channel and access all visual notes by visiting sozoseifoundation.org/events. Save the date for the 3rd annual Sozosei Summit to Decriminalize Mental Illness, December 5th through 7th, 2022, in Philadelphia, Pennsylvania. We invite you to attend in person or virtually.